Thank you for attending our first webinar, Introduction to Farm Culture. Before we begin, we would like to acknowledge that the land our farms exist on and the land we call Alberta is the traditional and ancestral territory of many peoples, presently subject to Treaties 6, 7, and 8, namely the Blackfoot Confederacy, the Kainai, Piikani, the Siksika, the Cree, the Dene, Saulteaux, Nakota Sioux, Stoney Nakoda, and the Tsuut'ina Nation, and the Métis people of Alberta. This includes the Métis settlements and the 6 regions of the Métis Nation of Alberta within the historical Northwest Métis homeland. We acknowledge the many First Nations, Métis, and Inuit who have lived in and cared for these lands for generations before us. We are grateful for the traditional knowledge keepers and elders who are still with us today and those who have gone before us. We would not be here without them. We make this acknowledgement as an act of reconciliation and gratitude to those whose territory we reside, farm, and live on. While recognizing the historical impacts of settlement on those lands, we wish to express our common goal to care for our water and natural resources for all future generations to share in.
So we are AgKnow. We're a group committed to supporting an Alberta approach to farm mental health. Our mission is to promote the mental health and resilience among farmers and farm families so that they can lead fulfilling and productive lives. We want to do more than just talk about the problems. We want to be part of the solutions. So we're working to identify the key issues, stressors, and needs of our Alberta farmers and to actively engage in the mental health and healthcare providers to address them. So let me introduce you to the AgKnow team. I'm Linda Hunt. I'm the director, and I work closely with the agriculture side of AgKnow. I'm a forage and livestock agrologist and a farmer with over 20 years experience working with farmers on production research and extension and policy. Dr. Rebecca Perk-Stephenson is joining me today, and she is a university professor working at the University of Alberta's Augustana campus in Camrose, and is closely connected to other researchers in the field, including those at the University of Guelph and their national strategy for farm health and wellness, as well as healthcare. Daddy Grovenveld is our communication expert who helps pull our network together, and she farms with her family near High River. And while we have different specialities, our common thread is that we all have experience in agriculture and in farming. Now that we have some introductions out of the way, we would like to welcome you to our first webinar on our professional development series. So this webinar, we will introduce the topic of farm mental health and why it's important. We'll describe farm culture and who farmers are, share some of the most current research in Canada about farm mental health, and discuss the key findings from our professional needs assessment that we conducted last year. And we also want to share our current initiatives and ways that we are engaging with our stakeholders. So as people are joining the webinar, I just ask that you please ensure your microphone is on mute. And if you have any questions, please save those for the end. Or if we run out of time, there will be a follow-up feedback form emailed to you, and we'd be happy to continue the chat directly or through email. Okay, so what is farm mental health and why is it important? Why focus on farmers is something that I get asked all the time, especially on the mental health and healthcare side of ministry. And of course, everyone is concerned in Alberta and in Canada about safe, affordable, and abundant food for generations. We're all concerned about animal welfare and environmental sustainability. And those are all places where farmers play a big role. And so while farmers make up less than 1% of the population, the entire agri-food system employs 1 in 9 Canadians and contributes close to 7% of the total GDP in Canada. So despite being an integral part of our society, there's research showing that farmers are often marginalized when it comes to programs and services. So what are some of the stressors that farmers are facing? This little infographic is a chart created by the Farm Credit Canada, and it looks at or explains some of the stressors faced by farmers. And if you look at them, you'll see most of them are out of the control of a farmer. So farmers are price takers. Input costs are determined by global supplies, as are the market prices they get for their commodities. For Western Canadian producers, The marketing choices are even more limited by low populations and a landlocked distribution. So if we look at the farming industry in Quebec and Ontario, most of that happens in the really south portion of those provinces, and so they have access to some big city markets in both the United States and in Canada. But in Western Canada, farmers are at the mercy of railroads to get their products to market, and they often compete with high commodities like oil for trains. The lack of marketing choices is a huge disadvantage to Western farmers and a significant contributing factor to what makes farm stress unique and worthy of public support. But who are farmers? So I'm going to talk a little about what we currently know about farm culture. And I'd like to start by saying that I've worked for over 20 years in Alberta with farmers, and I'm a farmer. I grew up in southern Alberta, and I now live near Edmonton. And in my other work, I work with the Agriculture Service Boards on policy advice to the ministry. So I get to witness firsthand and on a regular basis the culture differences between farmers from different regions of the province, between different religions, and farmers that are dealing with different commodities. So I found that goat farmers are very different than vegetable farmers, are really different than beef farmers, and on and on and on. So I want to emphasize that farmers are not all the same. They're a very diverse segment of the population. And so lumping them all into one category and trying to describe their culture is like trying to describe the culture of SESS directors or school teachers or nurses or something. There's a lot of things that they have in common, but there's some general trends we can talk about. But it's important to remember that everyone is unique and they're all sorts and types of farms and farmers. So the next few slides, I'll present some social economic stats from the 2021 census and give you some background on who farmers are. So one thing we can say for sure is that all farmers are business owners. Economically, most Alberta farms are classified as small businesses because they have fewer than 100 employees. Isolated working conditions and the seasonal loneliness are two common concerns with Alberta farmers, making the volunteering and community engagement a big part of managing mental health. Most farms, as you can see, are run as sole proprietorships, which means that the farmer is the owner, and many of these are family farms. The smallest category of farms in Alberta are the non-family corporations. So these are ones owned by investors who employ farmers to operate them. And like other small businesses, farm operators fall somewhere in a spectrum between innovators and traditionalists. So at the most extreme, the traditionalist farmers tend to be lifestyle farmers that have been either slowly using up the equity from past generations or subsidizing with off-farm incomes. On the opposite end of the spectrum is the innovators, which are always trying something new and looking for the next great thing. The majority of farmers fall somewhere in the middle of those two extremes. They watch the innovators try new things and adopt the ones that work best for their farm, and they have coffee with the traditionalists and celebrate the good old days. The extreme traditionalist is not likely to engage in mental health discussions until they're in a crisis, and the extreme innovators are constantly building networks of experts, so often have mental health supports already worked out. So in a business with tight margins and increasing competition for land and equipment, many farmers are employed or have off-farm side businesses. Working hard is a value pervasive in the farm culture. Working long hours under extreme conditions is a common topic of conversations at coffee shops and in community events. So community involvement and volunteerism are also very important to Alberta's farming communities. In fact, there was a recent marketing study by Kubota, which is an equipment dealership. They found that 72% of Albertans are actively volunteering on boards or in the community, which is well above the 48% that they reported as at the national level. So volunteering is a big deal to all Albertans, but particularly in our rural communities. So if you read through the testimonials on the white paper, both Dwayne and Sean talk about the burnout that they experience from trying to balance farm and family and community commitments. And it's important to remember that not all of the community commitments have positive impacts on mental health, as in the case of Sean, who was a first responder. A lot of farmers also are volunteer fire departments and end up going to some pretty tragic events. Most farmers have a natural inclination to be helpful and to do things for the good of others. I've been involved with lots of different research projects and community initiatives, and people remark all the time on how cooperative and willing to help farmers are. Community participation and willingness to lend a hand are values common in Alberta's farming communities. Farmers in Alberta and across Canada continue to get older. This means that many of the farmers are well established and are either looking at transitioning to the next generation or cashing out. So, getting into farming is becoming increasingly more challenging as land values and new technologies are driving up the initial investment cost. There's also a steady increase in the number of female operators that are being female operators, and because I am a woman who is a farmer, I also thought that was a pretty good trend. So diving a bit deeper into the data, though, I found that women operators are increasing in the 55 plus category and in farms with high revenues. So I'm not quite my peer group, although like me, they were supplementing their farm incomes with off-farm work. So let's talk about succession or transitioning. A major issue in agriculture involves the movement of farm assets to the next generation. The new trend is moving away from succession, where the farm is handed over to the next generation, to what we're calling transition, which is where the roles on the farm are shifting, but the farm isn't necessarily being handed over to the next generation. This is partly due to economic factors that are making it harder for young farmers to buy in. But feedback from conversation with farmers during the needs assessment indicated that there may be a widening generational gap, and a disconnect is making it harder to have those tough conversations around transition and succession. As you can see, very few farmers have a written plan for how they will transition to the next generation. And when we spoke to some of the advisors working in this area, it seems that relational issues get in the way of the business discussion. So even getting everyone to the table to talk about what's going to happen is a huge barrier. So these advisors were pretty supportive of the AgKnow concept, and we're excited to hear that we're bringing together a listing of farm experienced mental health professionals that they could refer clients to help tackle these difficult decisions. Just a couple more social economic stats that I came across that I thought you might be interested in. The majority of farms in Alberta are, of course, beef or oilseed and grain. The majority of farmers are married, and there is a very low divorce rate of about 8%. A 2020 study found that most farmers are either self-insured or have access to group health insurance through associations or through off-farm employment, although they recognized that this didn't mean that they necessarily had mental health coverage, and they didn't really focus on how many had mental health coverage in their plans. So roughly half of the Alberta farmers have some post-secondary education, and if I separated the men and the women had slightly higher rates of education. So now I'll turn this over to Rebecca, and she will share current research about farm mental health.
Okay, thanks, Linda. All right, so I'm going to talk to you about what we currently know based on Canadian research, and most of what I'm going to share is what's most recent. So I'm going to start by discussing what we know about what it's like to live in a rural community. And if you're from a rural community, none of this will be news to you, but maybe a little bit surprising that it doesn't happen to just you. So according to a 2016 census data, most farmers, of course, live in rural areas, even though there's a growing population of urban farmers. So predominantly farmers, right, are still in the rural areas. Now, in those rural areas, the data really highlights that context, which is the reality of many farmers and those in the farming community. So specifically, there are fewer supports and less access to health resources than their urban counterparts. So, for example, a little over half of individuals living in rural areas have, high-speed internet, which is important for, say, accessing a lot of, telemedicine or teleservices that might otherwise be accessible in the vast majority of urban households. Another example is that for there's one psychologist for every nearly 30,000 people living in rural areas, whereas in an urban setting, right, that number increases dramatically, where there's about one psychologist for every, still large, but about one psychologist for every 3,500 individuals. So really big difference between what's accessible and what's not accessible. And the more we learn from research of farmers, the more we're able to understand the problems and then the ways to help address those needs. I'm going to now talk about some research that was really seminal to the Canadian context. And so over the past 5 years or so, there has been in general a growing body of research investigating farmers. And much of this research was prompted by the relatively high suicide rate among farmers. And I'm going to talk about one Canadian research team that's been really influential, and that's Dr. Andrea Jones-Bitten at the University of Guelph. And beginning in 2015 to 2016, she's also a licensed vet. She noticed how so many farmers she knew and those in the ag industry were really stressed. They were burnt out. They were really struggling to cope. And her team conducted a large national study. And they surveyed farmers from all over the country. And they recruited or had about 1,100 farmers complete their survey. And what they found was that farmers experienced poor mental health at levels that were much higher than what you would expect or is reported in the general population or in other occupations. So for example, and I'm going to just kind of refer you to look at this diagram here. So among farmers, right, over a third of them met their criteria for depression, over half met the criteria for anxiety disorders, that is. 45% reported high levels of stress, and almost 70% were susceptible to chronic stress. And while their research was important and it filled a really vital knowledge gap, we're still left with a lot of unanswered questions. So for example, and I approach this with my kind of researcher hat. How does there wasn't enough data for us to know how does mental health differ across commodity groups. So Linda had mentioned how she's observed that there's differences between goat farmers, vegetable farmers, and cattle farmers. Wouldn't it be interesting to know if there are differences, or what kind of needs do each of these groups have? Or a lot of the data that they had was collected from Ontario farmers. Well, we know that there are some big differences between Ontario and Alberta context, right? The idea of what is remote and rural might vary differently in Ontario versus Alberta. Does that matter? And also there was in their study, there's approximately 100 Albertan farmers who were filled out their survey. But Alberta is one of the major contributors to farming in Canada. So I feel like there was a big gap that maybe we just don't know. We need to really understand what's happening among our farmers if there's going to be a national plan that unfolds for us to adapt. Perfect. So I'm going to follow up with another study that they did. So at the time that their study was completed, Andrea Jones-Bitten and her postdoc student, Dr. Brianna Hagen, they had developed a mental health literacy program for farmers and those in the ag community. So this program is called In the Know. You've probably heard of it, but this came directly out of Brianna's postdoc work. And since that first study, they had delivered the In the Know programming to approximately 900 people, mostly in Ontario. A vast majority were in Ontario, and they really wanted to know what was the impact that this had on mental health of farmers. How had the mental health of farmers changed across time? Did it get worse with COVID? So these were some of their questions, and they replicated their study in 2021 to see what kind of shifts have happened, what kind of impact did this education have, despite having COVID also sort of confound these findings. So they surveyed, again, about 1,100 farmers, and their findings were interesting. And for some of you, it might be a little bit surprising, maybe not, but in general, they didn't find many improvements. Now, a lot of this might be because of COVID, and it introduced another layer of complexities in mental health. But what they found was that farmers scored more severely on some of the mental health scales compared to the general population. So those are those normative scales. And In other cases, the averages were pretty consistent across time, meaning that across 2016 to 2021, there wasn't much shift. Farmers generally stayed the same in terms of their levels of depression, anxiety, stress. And when they looked at gender, what they found was that women tended to fare significantly worse than men across all of the measures. And I wanted to highlight one finding, a couple of findings rather in particular. And the first one is burnout. So I have the chart here on burnout. And burnout refers to that emotional exhaustion. So you feeling emotionally depleted, cynicism, you feeling depersonalized, and that you've lost that emotional and cognitive involvement of work, and professional efficacy. When you feel that you're being successful at work. And what they wanted to do is they measured burnout in 2015 and 2021 and compared it to those national averages. And as this chart shows, so if we compare how farmers are doing in 2021 compared to the norms, farmers on average reported higher levels of emotional exhaustion and cynicism, but we're actually a little bit higher on professional efficacy. And that might not make sense, right? They were persevering against, all of the hardship that maybe came along with COVID. And however, when we compared those rates, farmers' rates across time, we actually find that professional efficacy decreased in 2021. So compared to 2016, professional efficacy just kind of decreased, which again, COVID, they were working probably even harder to try to achieve the same successes. Things weren't as easy. And this, of course, makes sense in terms of supply chain issues, access to resources. And so how did they cope with this? The studies results are really interesting. They found that men tended to drink at levels that were considered harmful or hazardous, but it was still lower than the national averages. And this makes sense. As a farmer, you're not going to be quite successful if you're drinking heavily. You're not going to be able to wake up if you're drinking heavily, say, the night before. But they were, say, consuming a bit more alcohol than normal than they had in the past. And in terms of help seeking, right, they weren't reaching out to help. So about 1 in 5 farmers were seeking help. And when you looked at gender, there was a big difference. About 30% of women farmers were seeking help, whereas about 14% of men were seeking help. So you might be wondering, if they weren't seeking help, what were they doing? So a lot of active coping, a lot of farmers were using active coping techniques to manage their stress. Others were using other, techniques such as drinking or social withdrawal, sleeping more, changing their eating patterns. And now these avoidant coping strategies can set farmers up for other issues down the road. In fact, there's a growing research that shows that some farmers resorted to suicide. So many farmers and in the research also reported that there was a higher rate of suicide ideation. And in terms of suicide ideation, it was twice as high in farmers compared to the general population. And additionally, 1 in 4 farmers that were surveyed in Brianna's and Andrea's research reported that their life was not worth living. They wished they were dead and thought of taking their own life at least once in the past 12 months. Now, the relatively high rate of suicide among farmers, and particularly among white male farmers between 35 and 65, is not necessarily new information. It just hasn't been regularly reported. And this is partly because Canada doesn't report suicide rate by industry. Now, moreover, farmer suicides can be disguised as accidents, so we don't have an accurate reading of what that rate really is. I recently completed a study on farmer suicide, and with my research and existing research, it's estimated that the farmer suicide rate is somewhere between 2 to 4 times higher than the general population. I'm going to provide a broad overview of our needs assessment. So we were really interested in, as all this research was happening, unfolding, and there's a greater awareness of that there needs to be some sort of supports for farmers. We really wanted to ensure that anything that rolled out federally made sense for the Albertan context, especially because there was no research here. When Linda initially contacted me, I tried to find her someone, a researcher in this area, thinking I could do that, and I couldn't find anything. And that's really what started our partnership. But we thought, well, let's just do this ourselves, and we started with this needs assessment. So between November and April, we connected with over 60 individuals. And our purpose was really to understand what were the current services that were available in the province, what were some of the knowledge and communication gaps, where were some of those disconnects, and particularly we want to know what programs, resources, and interventions could there be to help farmers. And again, so that if there was a program that was to enroll in Alberta, that we could adapt it so it could be used given our current resources. All right, so one of the things that we noticed was that there was a lot of services that were available in Alberta. Like, Alberta is rich with programs and services. However, one thing we noticed was that on one hand, there's lots of services, and among farmers, there was a high need for these services, yet farmers were not reaching out to use these services, or very few people in their social circles were using it. They would much rather, say, rely on peer support or try to maybe work through this themselves. And in some cases, they had tried using services before, maybe it hadn't worked, and they had given up, saying, didn't work for me. So in other cases, too, we learned that these services just weren't easy to access. Maybe it was because of distance. I had mentioned the rural aspect and the remote aspect. They might have to take hours off of a day or a day off if they had to go into the city for services. Other farmers didn't recognize that they actually needed help. Like, they didn't understand and be able to recognize their symptoms before they were in a crisis. So there's a big knowledge gap there. And then, yes, other farmers, I mentioned they may have reached out, but then maybe it didn't work. And sometimes it takes a few tries to find something that really works for you, or you find a connection. In fact, research shows that it can take up to 4 tries to find the right support for chronic or complex conditions. So it would be helpful for farmers if we could facilitate that process, that help journey for them, so that they can get help on the first try that works for them, especially given that peer support for them is so important, right? So we want them to be sharing sort of their successes and stories of support with those that they know in their social circles. We also found, with talking with so many health professionals and community support workers, that they really wanted to engage with the community, but just kind of fell flat. They weren't really sure how to adapt their program in a way that was that worked for the farming community. So some of our upcoming research will explore these issues further, but our preliminary findings was really that there was this large disconnect between the ag community, health and community services, and researchers, right? So part of AgKnow's goal is to really, bridge these communication gaps and bring these industries together. Another key finding was that seeking mental health support or showing any sort of vulnerability in the ag community still remains highly stigmatized, right? So it's perhaps not, consistent with that stoic, private, hardworking laborer mentality. And also a major concern was that what would neighbors think? And if you live in a small community, you'll appreciate this. So in a rural community, it can be incredibly supportive, but can also feel like you're living in a fishbowl, in that people know what's happening, right? If you change something, you probably will get a phone call within 24 hours of asking, why did you change that? Why are you doing it this way? So I call this that rural panopticon, where people kind of know what's going on in the community. And that can make people who are struggling hesitant to maybe seek out help, because they don't know how it would be interpreted, or they don't want people to know. And they also don't want to seek help necessarily from someone working in their community who might share with someone that they know in their own social circles. So there's some research showing that connections between mental health and business productivity is important. And that's something that we really want to investigate further and communicate with our farmers. Our focus areas Now the needs assessment was really useful in helping to identify what are sort of the key areas that we should be focusing on as we sort of start our journey. And we found that there were 3 areas. So these represent those issues that farmers are struggling on right now. And the first one is farm animal epidemics and depopulation. So depopulation, this is the removal of entire flocks or herds due to disease prevention, environment disaster, or economic and market related factors. Now, while we can't stop these circumstances from happening, and we don't comment on the process used, we can help farmers through the process and ensure that they have the support that they need. And not just the farmers, but the farm family and the farm community. And the next, Linda mentioned farm transitions. So for many farmers, like the boundaries between work and home life are really blurred, right? Your son is your employee, your sister is your colleague. Farm transition and is more than just succession planning. It's how do you navigate retirement after being a farmer for 50 years? How do you hand over the family farm or take one over and make it your own? How do farm families navigate the changing social roles of their partners who maybe want to work outside the farm? So it's a really broad topic. We've dedicated time to study it and have connected with some experts in the field to really help guide us along the way. And then our third focus is farm family resilience. So we recognize that farmers they're not an island, but they're nested within their family, within the community, and then the broader society. So when you change one thing in that system, right, there can be a trickle effect that affects other parts or things in that system. So with that in mind, it's important that we build supports in these other systems to support farmers too. So all of our attentions or interventions kind of target each layer in that system so that farmers are supported from different angles.
So I just want to transition into some of our current initiatives that we have going on here at AgKnow, just to give you a heads up on some things that are going on. So struggles with mental health are common in the farming community. In fact, many farmers and farm families report high levels of stress, signs of symptoms of burnout, depression, anxiety, as we just heard. And so we want to provide an opportunity with anonymity and on their own pace for them to check in. And so we've created this self-check-in tool, which is available on our website. And it's sort of in the development and testing phases right now. It's a tool that you go through and you answer a few questions, and it kind of leads you through the thinking behind mental health and prompts you to think about the symptoms of mental health that you might be experiencing, and leads you to a conclusion whether or not you should seek help or whether you're doing okay. So the idea is it's self-directed, it's anonymous, which we know the farming community really appreciates, and it builds on the knowledge and awareness of mental health indicators. So our first community engagement campaign is scheduled to begin this February 1st. So we're hopeful to see this tool in action and continue to develop it based on community feedback. Another initiative that we have going on is we wanted to address the financial and access barriers to seeking help. So we now have a listing of 12 mental health therapists who have experience working with farm clients and have rural or farming backgrounds. And we can offer up to 2 free sessions for farmers and their immediate family members when they book through our website. So this list is growing. Without much advertising, we've been contacted by another 10 therapists who are also waiting to join our network. So if anyone is interested in joining, or if you know anyone that would be a really good person to add to our referral network, they can subscribe to a waiting list on our website, and they'll be notified by email when we open up the next recruitment campaign. There's an online application form followed by an interview, and then we put your profile up and you're good to go. So our goal is to have a referral network that blankets Alberta and can be responsive to the local needs identified through AgKnow's stakeholders and community engagement. Another initiative that we have is our professional development program, of which you guys are all participating right now. So one of the core principles is to enhance programs and services that already exist, and wherever possible to support the good work that's already being done. So the AgKnow initiative is being developed to identify the key issues, stressors, and needs of Alberta farmers, and to actively engage with the mental health and healthcare providers to address them. Our professional development program is one way that AgKnow is working to be part of the solution. So our goals are to work with mental health professionals professionals, healthcare practitioners to increase their understanding of farm culture, to increase knowledge of current farm-specific stressors and resiliency factors and the therapy and treatment approaches that are working for them, and gather feedback to help direct research and resource creation. So this year, we've planned a number of discovery webinars targeting the initial concerns identified in our white paper, and these events will be posted on our website and promoted as they become available. And healthcare and mental health professionals that are interested can subscribe to our website to get email notifications when registration opens. So this is a development year, so please bear with us as we work out some of the kinks. And by all means, reach out to us at any time with feedback or issues or concerns so that we can create a good process. There'll also be feedback form emailed to you after each webinar, and we always appreciate good constructive feedback. Last but not least, another core value at AgKnow is being evidence-based. So we want to ensure that we're addressing the right concerns in the right way. And to do this, we've partnered with the University of Alberta to look forward to generating new knowledge and best practices through research and community engagement. Our goal is that work in AgKnow would have an impact on policy, programs, and practices relevant to farmers and supporting their mental health.
I'm going to just briefly mention some of our research studies that have launched or they are launching in the next little while. So the first one is livestock depopulation. So this is the farm animal epidemic and depopulation study. So this is recently launched. I think we launched last week. And this is focusing on the lived experience of farmers or vets, farmers and vets rather, who have experienced farm animal epidemics and that depopulation process. And it's to help us understand what are some of the needs that they have in order for us to put forward recommendations and resources and tools, etc. So this is an interview study. Our second study that we're doing is the Farm Stress and Coping Survey. Now this is a replication of the Andrea Jones-Bitten study that was done nationally. So we've used the same measures with a few additional ones to really get an understanding of Alberta farmers. So it's Alberta specific, and we're hoping to get large numbers of farmers to complete that study. It's an online survey. It should take about, depending on how quickly they go through it, about 5 to 10 minutes. So not too burdensome at all. The third one is, and this will be relevant for I think most of the audience, is how to deliver mental health and support services in rural and farming communities. So we just launched this, I think this week, and we are interested in gathering feedback from people who work directly in the rural areas. So you can be a mental health professional providing counseling services to anyone in rural or farming communities, or someone who works in community support services like FCSS. But we're interested in knowing how have you found that you have to adapt your program in a rural setting? What are some ways that have been successful for you to engage with people in the farming community? What works and what doesn't work? And we're hoping to sort of amass a collection of recommendations so that if there is someone who wants to, say, set up a program or service in a rural setting, right, we can provide recommendations to help them get started so that they find success in that practice or in that business in terms of providing support to those who need it. And the last one is farm transition. So this will happen probably later in February, but we are interested in interviewing farmers who are actively going through that farm transition process or not. So half of our sample will be farmers who have yes, I've done this, and this is what worked and what didn't work. And then the other half of our sample will be investigating those farmers who are I haven't done it yet. And we want to know what are those barriers? So I'm really interested to know what those outcomes of that survey are. If you're interested in learning more about the research or want to share one of these studies with maybe you're interested in doing it yourself, or someone who would be interested, on our AgKnow site in the research tab, we list our research studies. So the livestock depopulation and delivering services in rural areas, that's listed there. And if you're interested, you can click a button and I'll get your contact information. You're also welcome to contact us directly for more information.
Thanks, Rebecca. Since evidence-based approaches are important to us, everything we're doing is following this plan, do, study, act approach. So using this approach, our long-term goal is to expand the referral network to blanket Alberta, provide more services more service opportunities, and to link to crisis recovery support. And we also want to maintain community engagement. We want to make the first step count. We want to maintain a presence in the agriculture community so that services are found easily and adopted readily. We're building an annual campaign that provides opportunity for community members to participate in relevant topics in the right seasons, and everyone can participate. And we want to be in a position to give good advice and perspective to program and policymakers to improve outcomes for farmers. Like Rebecca already mentioned, the livestock depopulation research is going. And so we'd like to also start with a livestock depopulation professional development webinar series. The first one will run during the noon hour, so 12 to 1 on February 22nd. Right now we have 4 planned to explore the topic of livestock depopulation. Western Canadian livestock farms actually have been pretty hard hit by depopulation in the past few years, and there are several diseases that emergency response plans are being developed for right now. So we're anticipating this to become even bigger concern over the next few years. So both government and our industry stakeholders identified this as a major stressor for Alberta farmers, and we're starting to explore the impacts and understanding the situation. So our goal with this depopulation series is to increase the knowledge of this issue and the impacts so that people involved can be better supported. Because of the nature of this series, though, we're only opening it to licensed healthcare or mental health professionals, but we plan to develop resources that will be more widely available in the future. So to register for this event, please go to our website. You will have to declare that you are a licensed professional and provide your number and licensing information.
And just to add to that, if I can, Linda,
Sure.
Because it's a 4-part series, right? We'll have collected some data that we'll be able to share with audience members. So it'll be sort of hot off the fresh insights into depopulation.
Awesome. So this is our website and our email addresses if you guys want to get a hold of us. And like I said, there will be that feedback form that's coming out afterwards. Thank you guys for joining us, and please pay attention to the next professional development opportunity as it comes up, and we look forward to continue working with you.